Okay, good morning, everyone. This is the 9 a.m. Board of Pharmacy meeting. I'm gonna start by reading a little preamble just to highlight the different aspects since we are back on Zoom. For internet access, to view the meeting and provide live oral testimony, please use the link at the top of the agenda. You will be asked to enter your name. The board requests that you enter your full name, but you may use a pseudonym or other identifier if you wish to remain anonymous. You will also be asked for an email address. You may fill this field in with an entry in an email format, for example, blank@blankmail.com. Your microphone will be automatically muted. When the chairperson asks for public testimony, you may click the raise hand button found on your Zoom screen to indicate you wish to testify about that agenda item. The chairperson will individually enable each testifier to unmute their microphone. When recognized by the chairperson, please unmute your microphone before speaking and mute your microphone after you finish speaking. For those using their phone access, if you cannot get internet access, you may use audio-only access by calling the Zoom phone number listed also at the top of the agenda. Upon dialing the number, you will be prompted to enter the meeting ID, which is also listed on the top of the agenda. After entering the meeting ID, you will be asked to either enter your panelist number or wait to be admitted into the meeting. You will not have a panelist number if you are a guest, so please wait until you are admitted into the meeting. When the chairperson asks for public testimony, you may indicate you want to testify by entering star in the number 9 on your phone's keypad. After entering star and 9, a voice will prompt you and let you know that the host of the meeting has been notified. When recognized by the chairperson, you may unmute yourself by entering star and 6 on your phone. A voice prompt will let you know that you are unmuted. Once you are finished speaking, please enter star and 6 to mute yourself. For both internet and phone access, when testifying, you will be asked to identify yourself and the organization, if any, that you represent. Each testifier will be limited to 5 minutes of testimony per agenda item. Excuse me. If a connection to the meeting is lost for more than 30 minutes, the meeting will be continued on a specified date and time that will be posted on our board website. Instructions to attend the State of Hawaii virtual board meetings may also be found on our website. Okay.
See, that's a lot.
We gotta do roll and make sure they're by themselves now.
Okay, yeah, so. We'll take roll. In the room, we have Sherry, Tokumaru, Brandon, Rabang, Alana, Isobe. And virtually, we have Mark Brown. I just need to confirm you're in a room by yourself.
Yes, I'm in my home by myself.
Okay, Catalina.
Yes, I'm in a room by myself.
Okay, we have quorum.
Yes.
Kent's excused, and that would be everybody. Okay, so chair's report. The only report or announcement I have is that Mark and I will be attending NABP what is it called? Item writing workshop, not workshop, item writing.
I think it's a
Something.
workshop. Yeah,
What is it?
I think it's a workshop.
Workshop for 3 days and 2 weeks here, in 2 weeks. So we'll be in Chicago writing some law questions. Next year, we're looking for some volunteers. That's the only announcement, I think, that's not on this agenda. So next thing is for the approval of minutes. Just need to defer that till next meeting. We don't have a copy of that yet to review. James EO report.
Okay, the only thing I have to announce for my report is the NABP annual meeting, which will be taking place on Monday, April 21st, 2025. So that's just something that I want to share. That's the only thing I had in regards to my
Who's going?
report. We have nobody from our board. Mark, are you going to annual meeting?
I am not.
Did they invite anyone? Because
No, I
normally
just
like,
got the notice. I'm sure they
no, they
want someone
didn't.
to come.
No,
but-
they normally send it to you and like they pay for someone to go to represent.
I'll take a look again to make sure,
Okay.
but I haven't
Not
seen
me,
anything,
but
but.
where is it? Somewhere nice. Where is it, Mark? Do you know?
I can Google it.
It's in Nashville.
Last time was Nashville. No, last year was Nashville.
Opryland.
18 hours flying and middle seats.
Let's see here.
Would you want to go? Are you guys going NABP? What is it?
Not NABP.
Where is it?
It is Fort Lauderdale.
Oh, God, that's too far.
Very difficult to get to.
Yeah, okay. Anyone interested? No.
I nominate Kent.
Kent? I nominate Kent to go.
Yeah, there you go.
Is there anybody who else would like to testify?
Oh, anyone else want to testify for that item? Okay. Anything else, James, for yours?
No, I'm good.
Okay, next item is for the PIG, the Permitted Interaction Group, evaluating HAR Title 16-95. Or do you guys have a copy of the PIG's
Yes.
changes?
So the PIG looked at a whole bunch of changes that were adopted at the last meeting, but they wanted to take a look at this remote processing issue, so they needed a little bit more time. So we provided what they voted and approved at their last meeting. The green is added language, the black is existing language, and the yellow years is when the board may have opined on some of these issues. So it is a key to recognize that this remote processing clearly indicates that this does not include dispensing.
This was included in agenda, right? So everybody has this?
Yeah, it's in the public
Okay.
packet, it's in, everyone has it.
Does anyone want to ask questions or comment about what they're reading? Anyone have questions or concerns about remote processing, remote supervision as definitions? So remote processing defined as entering of an order or prescription into a computer from outside a pharmacy or a pharmacy license or permitted by the board. And then remote supervision means supervision of a nationally certified pharmacy technician and pharmacy interns is in question via technology that at a minimum ensures a pharmacist is readily available to answer questions of the nationally certified pharmacy technician or intern and to verify the work performed by the said technician or intern.
And I think the board or the PIG noted that pharmacy intern will be included. So everything with pharmacy intern highlighted will be there.
Yeah.
As this moves forward.
And so I think that we in the PIG talked about adding that language of nationally certified, because I think last meeting we talked about, credentialing or some type of, education piece. So, we're allowed to put nationally certified in there. So we kind of just carved that in as just, they have to be certified in order to perform this duty. Not saying that all techs have to be nationally certified. It's just to do remote work, they need to be nationally certified.
Didn't we also say something about where they can do it from, that it has to be within the United States and?
Yeah, I mean, I think the PIG, we just kind of not mention, we stopped talking about that because it just goes down a very steep slope but I mean, we could definitely bring it back up, but I just don't know how you'd police it.
Yeah,
If we put this language in there, how would we know where people are working from? Even all these other people that remote working from some other country and no one knows, but Mark, do you want it to go back to the PIG to add that in, or? is
but
that
at
a
some point,
concern?
I mean, I guess. Probably should, but that there should be some kind of language in there. It's gonna be the responsibility to pick.
Oh, we can, okay. So we can amend it now is what we're saying. So we could say that it would be in the definition, or you want the supervision to occur in the United, it's coming from the pharmacy, right?
Yeah,
Wait, does it even say the pharmacist has to be in the pharmacy? No, right?
as long as they're licensed in Hawaii, no.
So I can't control really what the pharmacist is doing because they're licensed on their own, so they don't need to be in the United States?
But isn't the function of a pharmacist in the United States, isn't that in the definition or no? Practice of pharmacy.
Yeah, there's nothing that indicates that.
They just
Okay,
need to be licensed in the state or working in a licensed space, right? Okay, so if we put, so it'd be in the remote processing. Where would we put that? We put it in. Remote processing means the entering of an order or prescription into a computer from outside a pharmacy or a pharmacy. So outside. Pharmacy.
Outside a pharmacy.
But within. But within the country? Huh? Yeah, sorry,
Are
Stacey.
we trying to clarify that the pharmacist needs to be in this United States?
I think
the
technician-
working remotely,
yeah,
you
the
know,
remote
the
processing.
technician or intern.
The technician. Oh, okay.
I think.
Cause we were talking
In my
like.
head,
a
I'm
human
thinking like there's this
outsourcing.
room in, I don't know, India, where they're just processing all these things and sending it to the pharmacist in Hawaii. That doesn't seem,
Yeah, so we would put it on the remote processing definition. Remote processing means the entering of an order or prescription
The United
with
States.
it into a computer from outside a pharmacy.
Or maybe put it in B as one of the conditions required.
Remote processing,
Yeah,
okay, yeah, we could put it into B,
so Adam,
number 5.
So we remote processing and, you know. Number 1. We'll just add it to the list.
Hawaii licensed pharmacist unless,
I have a quick question on the certification for the technicians for remote. So for the certification, is that defined? Like, is it do they get certified in their state or is there a national certification that they go through?
yeah, it says nationally certified. It doesn't really spell out which ones. I know there's a couple, right? Yeah,
Okay, yeah, that, I wasn't just clear on that.
okay. Yeah, sorry, you don't have the handout yet. It's
Yeah, that's
the, I
okay.
forget what attachment it is. It'd be agenda item 5.
I'm sorry.
So yeah, it says nationally certified. So we would just add in that they would be performing this from within the.
or the technician is located within the United States.
Yep.
Okay, can we get you guys have to formally adopt that. So somebody has to make a motion to amend.
Make a motion to add that language to this document.
And that language will be added in the
New
yeah,
section.
16-95-XX, which is a new section will be created. In section B, we'll be creating a 0.5 that the technician is located within the United States.
I'll second that, yeah. All in favor?
Aye.
I,
Aye. Okay. Anything else from the, oh wait, PIG has something else. So what's the next step for the?
The board has to now adopt the document. Adopt the amendment and then I'll go ahead and add it to the other list, other amendments that we're going forth
The other
with.
stuff,
Yeah.
okay. Okay, so I move that we, the board adopt, the permitted interaction groups work with 1695-2 remote processing and remote supervision with the amendment that was just made, so that it can be approved. Can I get a second?
This is Sherry, I second.
All in favor?
Aye.
Aye. Okay, okay, so all yours.
Any,
Oh, you have a question? Oh, sorry.
Does that include the amendment to 1695-86?
Oh, it was 1695-2. All right, let's do 1695-86. We'll do that separately then. Do I need to redo this one? This one's good? Okay, all right, 1695-2 is good, okay? We're going to 1695-86. Supervision means.
so what our dash B would also extend to the 86 too, that they would be in the US, or do we have to do that again?
No, I
It's
mean,
already
this-
mentioned in there.
This is
under-
just the scope of practice.
okay.
I don't know if that's necessary.
Oh, so yeah, so 1695-86 is talking about scope of practice of a pharmacy technician, so. And this is where we inserted the nationally certified carve out, like what they're allowed to do versus non-certified. So, Helena, do you have it in front of you? You need me to read it.
I'm sorry, I need you to read it because I don't have it. in front of me.
Okay, so 1695-86, normally it just has a pharmacy technician may perform, and it kind of had the normal tasks that we have, so that's the normal standard. But PID is proposing to add language, a pharmacy technician and a nationally certified technician may perform. And so the normal task plus subset, the section B, which is a new section, a nationally certified pharmacy technician may also perform the following tasks not requiring professional judgment under the remote supervision of a pharmacist. And so prescription or order entry other than data entry, insurance processing of prescriptions and medication orders, and record keeping as authorized for remote prescription processing in that new section that we just adopted. Number 2, transmitting orders on behalf of the pharmacist. Number 3, communicating with patients and providers regarding information, including but not limited to verifying patient and provider information, collecting patient-reported information, for example, medication, self-monitored test results such as vitals, blood sugar readings, patient questionnaires, etc., relaying information from the pharmacist to the patient, follow-up scheduling or reminders, for example, refills, lab tests, appointments, billing, pricing, initial and refill requests, prior authorizations, rejections, and order status. And then number 4, inventory management or clinic administered medications in areas that provide direct patient care. So this would expand or expand and define like what a certified tech would do, differentiated from a non-certified tech. So
I have a question on the, so this language here, was this adopted and similar to other states like California and their certified technicians?
we use like
Or you guys-
Arizona and California. So in Nevada, I think we use several states to kind of look at what
Oh,
their carve out, like what the allowed certified.
so there's
techs.
nothing in this language that's in addition, that's not on theirs?
No, it's,
So they're just kind of.
we've deleted some stuff.
What they're doing?
It's consistent with other states. Like we didn't go rogue and add some weird stuff. This is kind of what other states, we did take out some stuff that other states allow just because we don't have regulations yet regarding technicians. So I think it's kind of on the more conservative side of what we can allow techs to do, and it's consistent with other states. It's a good question from the
I
public.
think we had another question.
Oh,
Oh, Tiffany has a question.
Oh.
She was wondering if she can't raise her hand,
oh, Tiffany can't raise her hand.
wondering if there's public comment. so that she
Oh,
can-
yeah. Tiffany, do you want to make? How come she can't raise her hand?
Hi, okay, I was unmuted. Hi, sorry, is there an opportunity for a question from the public?
Yes.
Okay, with respect to this section 1695-86A1, where it lists the scope of practice for a pharmacy tech, I have a question whether immunizations should be listed here.
For A1, or do you think it needs to go on B1?
That would be fine too. Oh, B1.
Or B, you know, with the nationally certified?
That would be fine. I mean, that's up to the board to decide. I think I'm just flagging for you that immunizations aren't listed here under scope of practice for a pharmacy tech under the rules, and asking whether that should be included.
Needs to go somewhere.
Thank you.
That's also in the law.
Didn't
right?
we do that last meeting?
Yeah, I thought that was part of your stuff, your packet, no?
Yeah, that's, I'm gonna look up, but I believe that.
Because that was already part of the extension of,
I would feel more comfortable getting a shot from a nationally certified.
I think it's required.
It'd have to be.
Yeah, so it'd have to go on to B if we're gonna. So we're gonna, if we're gonna add this section, then we'd have to rechange your section.
Yeah, I'm working on it actively, so I can, it's
Yeah,
gonna
so I
be rather
think-
easy.
If he's calling out, maybe we need to put it in. Because before it would have gone to A, right? Because we didn't have this whole new section B, but we can't put it really into A if we're trying to differentiate. Because if they're not nationally certified, they can't give immunizations, right? So it would kind of need to be in the carve out for nationally certified.
No, we added a specific section for immunizations. As stated in 461-11.4.
But we should probably just reiterate it with scope.
Okay, no, this is within the scope section.
461, what about 16?
I think it was a separate section, so, yeah. It was a completely different section of the immunization.
Yeah, in the immunization section though, but we should probably, it wouldn't
I mean,
hurt to put in 1695, right?
Is what we were looking at. We added it as a third point under point A. So if you guys.
Oh, but the top section of that
Was a
is,
pharmacy technician and a national certified pharmacy technician in this one.
but it doesn't say that they have to be certified though, right?
Well, you have that language in there.
Well, now, but this one, the way it sits right now, it's not, right?
But then it references the statute,
per-
which references the statute which requires them to be nationally
Certified.
certified. So I mean, if you guys wanna,
It's pointing to 461-11.4. But the way, because we didn't have that new section. So we could, if we leave it there, if we leave it in as point, he has it as section 3 or something now. Of A,
yes,
and pointing to 461-11 point whatever, 5 or whatever. That just seems confusing. It seems like it might.
you guys wanna move it to B, we can still do that as well.
I mean, if we're gonna be touching if we're gonna touch 1495-86 and add in a pharmacy technician and a nationally certified pharmacy technician then that implies that this section on the top would be able to do all of these things, and then the section on the bottom, I just don't want them to get confused.
Yeah,
Confused reading rules, what?
Wow. So.
yeah, I think we should put it in the B section. Especially with the one bill that we have. About the registration that has. Talking about immunizations as being a registered technician.
Well, then we're gonna have to change it again. Language would then say registered versus nationally certified registered. Oh my gosh, there's gonna be a lot of words. Okay,
Yeah.
immunization. What's the language in that one say? Can we just copy that language and just put it into, move it to number 5? Administer vaccines for persons 3 years of age or older, provided that requirements stated in 461-11.4 HRS are met. Is that sufficient? If we move that to number 5?
Yeah. Sounds good.
Tiffany, you think that's sufficient to move it from where we started on as number 3, move it to, it would be subsection 5 of B, 1695-86B, number 5, just move that whole verbiage. Tiffany, is she in there? Did she hang up?
Please unmute.
Unmute Tiffany.
Sure, I actually, I can't see section 3 in the document that I have.
Oh no, so number 3 was added with our last
Okay.
amendments.
You want me to read it for you, Tiff?
Oh, it's okay for me. I mean, I just wanted to flag it. Thank you.
Thanks,
Okay.
Tiffany.
Yeah.
So you gotta-
So I move that we,
Would the board want text to be able to immunize not under the immediate supervision of a pharmacist though? Because B talks about remote supervision.
See, that's a good point.
Yeah,
oh,
I think it's okay where it's at then.
okay, leave it.
Yeah, I think so.
Oh, because A was intended to be immediate and B was,
Right.
I was thinking it was the other way around. It was like,
Actually, see,
okay, so leave it.
yeah.
So So it wasn't really carving out nationally certified, it was just carving out really what the remote
Remove it
was.
for remote.
Okay, okay, sorry, leave it. Okay, so we have to approve.
Elena, this is
Hi.
Catalina, sorry. Or go ahead, you could finish that part. I
Oh,
have
no,
a
go
question.
ahead, you can.
Okay, so I have a question just for, I'm really curious about this part. So for the remote, right, for the techs, remote certified techs. You know, for like, let's say an Amazon, right, like the big corporations, would this maybe disrupt anything that they're currently doing to fill scripts for Hawaii residents? Because I know there's a lot of outsourcing going on. Would that impact it at all? Or could it, or do we know?
Well, those guys have a license. I mean, I think they're doing it from
But
another
if they're
state already,
using-
right? Mailing,
Yeah,
shipping here.
the pharmacists have licenses, right? But I was just curious to know if those companies were having remote technicians do some of their work. I don't know. That just popped in my head. I was just curious.
I don't know what they're doing now. We have no idea what they're doing now.
There's no way for us to regulate it either.
No way of knowing.
That doesn't change my decision, what they do.
Okay.
Yeah, just as long as they're within the United States, we got it in there.
I just didn't know who was using remote tech, remote folks from out of the country to do technician work now.
Well, right now, the way it is right now, without this change, then they shouldn't be doing anything remote, that they need to be in the four walls. But we wouldn't know that anyway, so this would just make it allowed. Spelled out that it's allowed, so right now that the way it is today, they shouldn't be doing any, tech shouldn't be doing any remote work because they're not supervised.
Mhm.
Okay, so can I get a motion to approve 1695-86? So 86 A and B, what they do with immediate supervision versus remote supervision. Okay, I move to approve 1695-86 A and B, the way it's written.
I second it.
I second.
All in favor? Mark said
Aye.
yes. Marlena, you okay?
Good. This Catalina, yes.
Yes, yes, okay. All right, so 1695-86 can move ahead.
Is there anything else? Any
I have
other?
a question about the interns, since we're exchanging between the pharmacy techs and the pharmacy interns. Is that gonna contradict what's in 461 about pharmacy interns being under immediate supervision of a pharmacist?
Contradicts?
Yeah. I mean, if we're now putting pharmacy interns under the category of being able to do remote work. In 461, no person other than a registered pharmacist or pharmacy intern under the registered pharmacist immediate supervision.
It may, and then it will get flagged by the DAGs and they will let us know that it's contradictory and it's gonna cause issues, and then it will have to be either changed or removed.
And I don't know if pharmacy interns are doing, did you guys come across that when you're comparing other states, if interns are doing remote work? That don't have a national certification that are still in school?
They are, like, most of the time, most of the states, they lump in, interns with techs. So like if a tech can do it, interns can do it. And I kind of agree with that. I mean, if we're gonna let a tech do it, but not an intern, that seems kind of like wrong, but. So they kind of lump those things together. Versus the reverse doesn't work, right? If an intern can do it, the techs can't do it. But if the tech could do it, for the most part, I haven't seen any states say the tech can do it, but the intern can't. Could you guys hear the question?
Oh, yeah.
Yeah,
we can hear
conflict,
about
yeah.
It's about us, yeah.
Okay, so it was adopted. So is there any other questions? I just want to make sure, can someone raise, Tiffany, can you raise your hand again? I want to make sure, will it even pop up or will you only see it, Julie?
Johnny's handling that.
Oh, okay, okay.
Okay, so
Alrighty, I just want to,
Johnny, do we have any questions in the audience? Since we can't see it.
Chair, we don't have any questions.
Okay, thank you. Just yell if they do have a question, because I can't see. Okay, so for section 5, for the PIG, we're done with this then, right? Okay.
So I guess- yeah, so I guess the next steps in regards to this amendment, I will be adding it to the other rules amendments that the board passed at their last meeting. And it will move forward for review by, first by our department heads and my boss, and then it will go over to the attorney office. And then, once it goes through the appropriate legal checks, we'll open it up for public hearing to get public comment on our rule changes. And then we will bring the comments back to the board, and then following that, it will go through another legal check, and then Small Business Registration Bureau, a regulatory board, where they will get to comment on the rules, and then it will go back to us and another legal check, and then be approved
Keeping the
eventually
lawyers-
somewhere down the line. So this is gonna be a long process, and this is not the last time you guys will be looking at the rule changes. So, I just wanted to provide some context for everyone who's attending as a guest and in here, who is not used to the rules processes. This is a rather long process, and this is just the first step. So, stay tuned.
Setting realistic expectations.
Can
Any
I
questions?
ask a
Oh, yeah.
question? That was a very good question about whether the remote supervision exceeded the 461.9. Do pharmacy techs in general get more supervision than the pharmacy intern?
Well, no, it's just that their job duties are different, but right now, the way that it sits is they're all directly supervised.
Well, actually in 461.9, the intern has immediate supervision. And then the farm tech just says supervision. C. So is it looser for the pharmacy tech?
I would hope not.
It sounds like.
Because interns aren't licensed yet.
Neither are techs, though.
Neither are tech. So how does it work in the real world?
There's, for me, they're treated the same.
I mean, it's interesting that the pharmacy intern in 461.9B has the word intermediate
Or immediate.
or immediate, I'm
Yeah.
sorry. And it's not there in C for the farm tech.
Somewhere else we did find immediate though, right? We found immediate for some rules. Oh, it's in rules.
Yeah.
Well, interesting. Intermediate is in both 1695-85 for the farm intern and 86 for the farm tech. Immediate, but it's not in the HRS.
So the rules clarified it.
Okay, so that's something we'll definitely take a look at moving forward. Ready to move on to legislation, Chair?
Yeah, let's move on.
All right, so first bill is HB 72, which coincidentally is requiring interns or requiring technicians to be registered by the beginning of the new year. Imposes a duty on the pharmacist in charge to report violations conducted by a registered pharmacy technician, and specifies that supervising registered pharmacists are responsible for the actions of the registered pharmacy technicians and pharmacy interns. So far, this has passed through the House and will now cross over to the Senate. I have been providing testimony based on the PIG's views that you guys recognize that at a minimum, technicians should be registered, to acknowledge that all those technicians that have gained extensive on-the-job training are not cut out of the process. But I did note that you guys would be looking at this bill at this meeting. I've just been kind of reiterating what we've said in the past.
Yeah, I read your testimony. I think it was accurate to what we've been talking about. Did you guys all get a chance to read?
I had a question on section 7. It's adding registered to that, but it doesn't say certified techs as far as immunization. I guess it does in 5, sorry. That they have a certified pharmacy technician. Okay. When I first read it, I thought it was just being registered allowed you to immunize.
Okay, so, does anyone in the room or on Zoom wanna say anything about House Bill 72?
Chair,
James,
we
you're
don't have any testimony.
Okay, you're gonna continue to just follow and just provide that same.
Yeah, so as far as the board goes though, I can continue to submit my testimony and comments, or do you guys want to support this registration requirement?
Hold on. So one of the things we had talked about at the period was the definition in the bill. Regarding registered pharmacy technicians, because this is 61. It may trump what the PIG had done in terms of remote supervision.
Oh, so we'd have to add,
That's if this law passes, so.
but so the board wouldn't wanna endorse this and then this, like, we'd have to say we would like an amendment to it to kind of improve this language.
I mean, it's a difficult position because who knows if this bill will pass, so we could be changing our rules to fit this bill and then the bill won't pass, but what we'd also talked about at the PIG is working on these things concurrently, and if something needs to be changed, I mean, if this bill passes, it will get caught during the legal check portion of our rules amendments, and then we're gonna have to alter it. But it is a good point that Stacy brings up.
I mean, is that something that could be amended in this, could we recommend an amendment to House Bill 72 to include what the PIG's done?
Yeah, if that's what you guys want to do.
I mean, because would that solve this?
I mean, what is the amendment saying? What would the amendment be asking for?
Is he adding registered, nationally certified?
Wouldn't
Technicians.
it complicate things though, as far as getting it
Yes,
passed?
but, yes, but, then it would, so if this bill passed, then this would stop this, but if we add this in, we can get both of them done at the same time? Sherry?
I'm sorry, could you repeat that?
So if this bill passes, it would complicate this big. If we amend it to put this into here and it passed, we'd be done.
But how? Could you explain again, Stacy, your concern related to?
Yeah, so I think the way the current definition reads in HB 72 is contrary to the definitions that the PIG uses for remote processing and remote supervision. Right, because this definition says that the technician needs to be in the mix.
It just reverted back to what it was before, right? So,
Well, it uses direct supervision. I think the current language is immediate supervision.
but yeah, basically this one is just inserting the word registered to the old stuff versus if we, and what Stacy's saying is like, we would then have to,
Because there's no language on remote.
right, so now, it's not that it's gonna complicate, it's just gonna, we're back to where we were, right?
We won't be able to.
So what if we took out the word
What if we
direct?
did immediate?
Or if we just took out the word direct and just put supervision under the supervision and control of the registered
I
pharmacy?
mean, would you have to define supervision as including remote?
Well, right now supervision is not defined in 461.
This
It's all
would,
defined in the rules.
Rules.
this would added definition for supervision,
It says physically present.
So you take out the rack.
There's no national certification assumption, right? So we were talking about nationally certified techs being able to do remote. But in this case, the assumption is that they're physically present because we're not lumping the nationally certified techs into this bill.
Okay.
But.
Where that, I'm just explaining where that definition came from,
Oh, okay.
because they're two separate things.
But if you're nationally certified, does that, does allow you to not be physically present?
So right now, there's nothing about national certification in this bill.
Mm-hmm.
Or remote at all in the bill.
Right.
So right now, there's no break.
There's no distinction. So everybody, even if they're certified, would have to be under the physically present supervision.
In the bill.
In this-
What if we just took out direct and physically present? We requested those two.
And it's drawing attention there, they're gonna freak out. Right, we're physically present, what section?
Under supervision definition. That means for line 10. So,
Wouldn't that still fall within the carve out that it's a different group?
no, because this would supersede anything.
Law's gonna supersede rules. We just cross off this whole supervision.
I mean, how would you guys feel?
I was gonna say, I can tell, so the state association is the one that was putting forward this bill. Our main priority is that techs are registered in the state. And I worry about overcomplicating it with that much additional language. So when I approached the consumer protection chair who introduced the bill for us, it's very simply understood because we're not trying to put in national certification requirements. We're not trying to put in all these hierarchies. This bill is very simple as it stands because we're just looking for the first piece, pharmacy technician registration. So my concern is that when I take this back to my government affairs committee, if we wanted to, or if the board voted to put in all this pig language,
Okay, but
I fear that it's
Yeah.
now so complicated that we must be in conjunction with each other because our main priority this year was
Just to
let's
get-
at least get the list of registered pharmacies.
what about if we took out supervision definition? I mean, that's like, adding a layer of like sticking point for the board then, because I don't know if we can agree that this is what it needs to be defined as.
And also the word direct on line 7.
That's a start, right?
Yep. Like if we remove direct, we remove supervision definition, because I think that we've talked about supervision before, like this one is kind of not the.
But in the meantime, while that's not anywhere, and it sounds like this is gonna be a long process, does that now pose a public safety issue if you take away direct supervision? So now all registered pharmacy technicians are just allowed to potentially have remote.
No, because you still have it in your HAR.
Or I think maybe if you leave
Oh.
direct here or immediate, we change it to the word immediate, back to the word immediate, because they're all registered. We can still do pig, right? If we made this immediate,
And then
Get
you're
rid of
separating
this.
the remote processing part.
yep, and then you keep this separate. But I mean, like putting direct, no, that's not the same word that we used
I
before.
mean, they're gonna be separate regardless because this is rules and this is laws, so we don't have to worry about any of this language getting in here.
No, but if we have a law that says supervision means,
Mhm.
and it has the word physically present and whatever, then that's like Stacy said, it's gonna kill this. Cause it's in law, but if I take out the word direct and to make everyone happy, I put the word immediate in the registered pharmacy technician, line 7. And kill 8 through 12, because I don't think that, cause that probably not necessary. Right there, then, but put immediate, cause that means like the other people that are not certified, they should be immediately supervised. But then that still allows for this, right?
Matches the rules.
Still allow
so-
this.
Everyone has to be under immediate supervision, whether it's nationally certified or not. There's,
If I put immediate in line 7, it would kill this thing too.
Any ultimate thoughts for you? Do you think if we take out? I personally think it's. If we ask for that, something like that. That, it may,
Or
gonna
take
take
out the
that-
word direct and just put supervision, but then that would allow the non-certified people to go without direct supervision or immediate supervision, right?
how does the nationally certified not be subject to immediate supervision?
That would be.
I think that's what
only if
they're
the
creating with the
yeah,
pig work
right.
rules.
If it passed. But currently, all technicians need to be immediately supervised. So
Right.
what we're proposing in the rule change would be that if they were nationally certified, then they could work under.
Without supervision, but only for X tasks that are considered like clerical. Not all dispensing air, all this other thing, it's just in this one subset of like duties that are not like judgment based.
I can think about that one.
What if we changed it in line 7 to be consistent with immediate?
Mm-hmm.
And then I think supervision is going to need to be defined, even though it does complicate things. But what if we take out physically present in line 10? And then that allows some wiggle room for what the pig group wants. But I do think supervision does need to be defined. I feel like we can't just nix that.
Yeah, I think if we
The
try
pig
and-
work group. So. Again, I can only speak on behalf of myself and my thoughts right now. I have to take all your amendment recommendations back to my government affairs committee before I can speak with 100% confidence, but. Loosely, I think if line 7, we put immediate consistent statute. And then we take out physically present, that gives you some workaround, well, not workaround, but that gives the rules some flexibility if that. Still runs good. Or is everyone reading that differently than I am?
I think that would work.
I think that,
Mm-hmm.
and I think that's maybe lawmakers, because technology is coming, remote. That's not a stretch, that needs to be addressed.
And the beautiful part about this law is now they're all registered in the state, so if they're acting in malpractice or something that's inconsistent, it's reported now to the.
Rico.
We just need
Yeah.
someone to catch them. That's all.
Okay, so, but the only thing is like, if we put immediate in there again, it does have in the list of things that they can do, all these non-discretionary tasks that the pigs just said that we don't need immediate supervision for. So is it gonna kill this?
Okay, so just you're suggesting then remove immediate or direct, just leave.
Well, I don't know. I mean, that's probably bad too, but, appropriate.
I mean, and another like big picture thought is that. We consider putting, if this bill were to go through. When you guys finalize what you want that big law to work, I don't know, I think. The baseline of this bill is that once we start having requirements for competency with national certifications and other things like that, eventually that would go into statute too. But for some background, what has happened when other states require national certifications off the bat, you lose a lot of your technician workforce because they don't want to become nationally certified.
Yeah, and that's what with the pig did 2 summers ago. We talked about that and giving them some grandfather time and all this other stuff, but.
So that's the concern about putting too much about the national certifications into it right away, but.
What if you just remove direct from line 7? And so it's just supervision and that the PI language would not contradict with remote
Versus immediate.
versus immediate.
Okay.
So,
You okay with that though?
yeah, it's more, it's less contradictory,
Yeah. And broader?
broader, more flexibility, and then remove the definition of supervision. Unless you wanna keep supervision and just
Take out the
remove
physically present
physically
part?
present.
I think supervision needs to be defined. And so I'm happy to take back to my board to remove.
Is supervision defined before? No, it's
No,
never
that
been
is
defined.
not.
That's why they're adding this now.
Or 461.
Yeah, I mean, I know physically present needs to go, otherwise it would contradict everything we've discussed for 2 years. And it hasn't evolved, we haven't evolved one thing from 1980, like remote work and remote.
Well, the interesting thing is that you actually had remote.
It's coming back.
But I think we're on the same page then if we take away immediate and direct in line 7 and then take away physically present in line 10.
I think that would keep the pig alive.
It would keep the pig alive, but
It's something I think that the pig group and the board can live with, I think, and still support.
But is that now a public safety concern, right? Before this pig stuff goes into effect, do we have a gap where
It's
now?
not a new gap. It's a
It's
gap
still in the
that's already there.
rules. I mean, the rules say immediate, so.
Still have to be used.
We just can't.
Oh, 'cause
close
rules
the
is there.
gap.
Okay.
It's the same gap. We still had the gap.
Okay. Okay, so we'll look at the gap.
We're not creating a newer gap.
It's already there.
Okay. Okay, so even if immediate is not in statute, it sounds like it's in the rules, so
Yeah.
from, okay,
Correct.
okay.
So, Kelly and Mark, are you guys okay with those potential changes?
Yeah, I think that's a way to get it to go through.
What about public comment? Anyone else? Tiffany,
Here's a question.
CDS. Rob's on there. She has a question? Is she raising her hand?
I don't think she's on actually.
Can we unmute? Tiffany and Rob, and Steven, because they're all part of the pig. Can we unmute them and see if they have a question?
Sure, there's just no raise your hand function that I can find,
Oh, okay, yeah.
so,
We unmuted you, so now you can say.
thank you. I just in listening to the group, I had a question. In the HB 72, right, under the current law, right, 461.11.4, paragraph 5, it does say that pharmacy techs like have to have a certification, right? So, and those are national certifications, is that right?
Yeah.
So, I mean, the bill is just requiring, adding the word registered. So if this were to pass, any registered pharmacy tech, would have to have these national certifications anyway.
To do.
Right. So when in the rules, you create a distinction between nationally certified and not nationally certified, I guess just under the law, they would have to have one of these certifications even to be a pharmacy tech.
That immunizes.
Right.
To immunize, yes.
For immunizations.
Yeah.
Yes.
Well, for right. So that's a separate distinction then for immunizations.
Yes.
Okay, and then I agree with, I hear what Corey is saying and I agree with it. I think there probably does need to be a definition in the bill. For supervision, and I can appreciate all of the perspectives on it. I think that's all from my perspective.
And I'll make just one quick comment on the topic. For the record, just Rob Geddes with CVS Health. In discussing and listening to your discussion on the topic of immediate supervision, I think that I haven't looked at exactly how the term immediate is defined in Hawaii, but other states that I'm familiar with, generally immediate supervision means that the pharmacist is immediately available to control what that technician is doing. So I think that immediate supervision can still be applicable, whether that technician is being remotely supervised or in person within the pharmacy. Just due to the technology advancements where technicians can be in communication immediately with a pharmacist, that still is applicable, and that's how other states have kind of solved some of the dilemma that you're discussing at this point. So otherwise, agree with a lot of the work that's being done. Appreciate the work that the PIG has been doing. And then the last thing I would just mention, just for anybody else on the call, I did find the raise hand feature. It's underneath there's a heart that says react. If you click that, you can click raise hand. So it is available for us.
Thank you. I didn't want to have a reaction. Okay, I see it now.
I did the
It's been
same.
5 years and we're learning Zoom still. Like, I
Well,
don't know. Hey, there's a reason I'm here. I'm done using technology and I'll just come. Like,
Okay, Steven wants to
Okay.
say something.
oh yeah, he found it. Look, there it is.
Yeah. So, quick question, maybe I missed it. Did we define registered pharmacy as, and then define nationally certified? Because I just want to make sure we're not confusing anybody. So that way we're able to define and
Yes.
say it's state
The-
registered and nationally certified. I
think
don't
there's
want,
a definition.
want to make sure it's not one and the same.
Yeah, there's a definition here. It says auxiliary pharmacy personnel in section 2, right? And then the next section is registered pharmacy technician means a person exclusive of pharmacy interns and auxiliary pharmacy personnel registered with the board who may, in addition to the tasks of an auxiliary pharmacy personnel, so many words, perform filling, packaging, manipulative, repetitive, or other non-discretionary tasks and tasks specified in section 461-11.4 only while assisting and while under direct,
That's what we're gonna take out under the supervision.
under supervision and control of a registered pharmacist.
Nationally certified is not his bill.
Right.
Because she brought up the workforce concerns.
Okay.
But I do think Rob's comment was helpful. I think immediate would be appropriate in line 7 then. It means immediately available.
But we didn't define that. And
It's in the rules.
it is in
It's
rules,
actually physically present.
physically.
Oh, okay,
Yeah,
that's
it's
right,
in
that's a
the rules.
contradiction. Okay.
Okay. So what I'm hearing to kind of push this along a little is that some board members want to support the bill, but request an amendment to page 4, line 7, removing the reference to direct. And in page 4, line 10, removing physically present. Is that what I'm hearing?
Yes.
There's also, wherever it says direct, I think, like, there's another one that says, anywhere it says direct, like, I didn't read the whole paragraph, but like page 9. That's a word, I'm just skimming for the word direct, just to make sure we don't miss it, but,
A registered pharmacy technician. This is related to text.
huh? Out, provided,
You want to remove it on page 9 as well?
I mean, isn't that the same thing? I don't know why it keeps.
That's related to tech. Oh, yeah.
Huh?
Only while, yeah, we can remove it on page 9. So remove references to direct related to
And
supervision.
can we just say like why I mean, I don't want people to think we're not
Yes.
supervising it, but.
I'll let them know that the
our
PIC is
rules-
working on.
No, our rules are already saying like, we use the word immediate
Okay.
and we define it in rules. To make it more strict or to add a different word is more confusing. So like, we don't say we're doing pig or we're gonna try to do something else and then the legislature like, wait a minute, you guys are trying to sneak one by us. The reason we're putting direct or we're trying to eliminate that word is just that it's contradicting our existing rules and gonna confuse it. Then we do this later, you know? So we want to say as a board, that's why we want that word removed. Not because we don't want people supervised and we just want them to just kind of do whatever. It's just that we want to remove that word. That makes sense, right?
Consistent with your HAR.
Consistent, yeah. Okay, James, consistent with
Yeah.
HAR. Okay. We have to vote.
Yeah, so I need a motion of, I didn't really get it.
So, okay, I'll make the motion, because I motion that we, the board support HB 72. With our amendment or recommendation to remove the word direct supervision and physically present, from that section that we just talked about. In order to be consistent with our HAR, definitions already, and to prevent confusion.
And to remove physically present.
And then remove physically present from the supervision and the word direct out of supervision
Okay.
on those 2 pages. Can I get,
Replacing it with.
we're not replacing it, we're just taking out that word. We're taking out the word direct, we're taking out physically present and leaving everything else. Direct is twice.
Yep.
I second that.
Okay, all in favor? Sherry, you happy with that? Carolina? Unmute,
I'm good.
okay with that? Mark?
Yes, I'm good with
Okay,
it.
James, you got it?
Got it, okay.
You guys
So,
okay?
Corey, you're gonna take that back to the policy?
Okay.
Okay, so next we have SB 1245, there is also an SB 324, which was deferred, but they're using SB 1245, which is mandating reimbursement for services provided by participating registered pharmacists practicing within their scope of practice by private and public health plans in the state beginning January 1st, 2026. So there has been a lot of testimony and support. It has made it through the Senate and will be crossing over to the House. I've also reiterated our testimony from last year in regards to this bill that was in support. The only issue is that there are some other state departments, DHS that's asking for more time. HMSA is also noting some issues related to team-based care. So that may complicate the issue. But other than that, it's all the testimony's been in support.
Yep, I saw your testimony and I think, do you need us to support?
It's pretty much the same bill from last year. Okay, so moving on. SB 223, which is related to the Center for Nursing, has unfortunately.
Pharmacy.
Center of Pharmacy, sorry, passed their consumer protection, but never made it to the finance committee and missed the deadline, so I was supporting putting testimony in support, but requesting an oversight committee. But unfortunately, at this point, yeah, it was just the same as last year and it didn't make it. So that one is effectively dead. Well, I mean, it may return next year.
Oh, okay.
Can I make a comment too for the board? So we're fine with having an oversight committee. The state association again put forth this bill. Prior to next session, can you guys give me exactly what you would like for the oversight committee? Whether do you want that to be a board? That's what the Board of Nursing does. They have a board that's got a couple different health professionals sitting on it and some public members. Or if you want that oversight to come from the university, or if you want, whatever you want that to look like, it would make the process much more seamless. You guys have that outlined and then we can reflect it.
Yeah, I mean, I think
Proposal.
based on the comments, and this came from board member Kikuchi, he wanted to make sure that this Center for Pharmacy is separate from the university. He wants to make sure that it is actually really pushing workforce issues and not kind of serving as a agent of the university to push their own kind of initiatives. So I'm sure I'll let the board members comment, but I think they want independent people of the university, so.
Yep. And that's exactly what nursing does, so we're happy.
A diverse oversight committee, I guess, would be my recommendation.
Okay. And would you want, I'm just putting things for forward thinking, do you want a specific number of members on the board? Do you want them to be required to be of certain health professions? So, Alana, I love your comment, it's very loose, but I want to make sure it's not gonna cause any.
Did I make a comment? I just said that's diverse. I mean, like, you know, we don't want it all academia. I think is what we talked last year, maybe about having this just so that everyone's voice, because everyone's a pharmacist and, you know, the board has different types of pharmacists here and you get different perspectives, like hospital versus retail or versus academia, that it's just kind of mirrors like what the, you know, jury of the pool or the peers or whatever, to make it just kind of a whatever, an evolving group that is.
Do you know how big the oversight committee for Center for Nursing is?
I don't.
Oh, okay.
Probably huge.
I think it's 7. I don't think it's as big as you think, but they have like a nurse, a pharmacist, physician, public members. Similar to. Like, so if you want a board of pharmacy representative on that committee, I think it's totally appropriate. Just let me know.
Okay. Any comments from the crowd on that bill? Yeah.
Now that they know how to raise their hand, we can.
Yeah.
Yeah.
So the next is SB 1279, and HB 561, but the House bill was not heard, so the vehicle seems to be HB or SB 1279, which is related to telepharmacy, pharmacists, and medically underserved patients. This authorizes a registered pharmacist under contract with a covered entity for the purposes of federal 340B drug pricing programs to supervise via telehealth the filling or receipt of a prescription. The testimony, our board testimony, I reiterated concerns with a similar pilot project that we had that used telepharmacy in a federally qualified health center. And some of the concerns that the board noted was that without proper implementation, the level of care being provided to patients through telepharmacy may not be equal to what is currently provided in face-to-face interactions with a pharmacist. In the pilot project, the board also received some comments from pharmacies in the area willing to work with the health center, which the board thought would better serve the patients. And also in telepharmacy, as represented in this project, it required patients to schedule a time to speak with a pharmacist when you don't really have to schedule a time when you go into a pharmacy and speak with whoever the pharmacist is providing counseling. So I just said that it provides the patients with a less, not the same standard of care as provided currently in our statutes and laws. Any other issues with this bill?
I have issues with this bill. It just seems like it's pretty vague and like when we just talked about, remote.
Yeah.
And we just, for the last 40 minutes, talked about supervision. And this is just like completely not what we just talked about. We talked about not filling and not doing all these things without direct or immediate supervision. And so this kind of, we just need to reiterate that the board really believes that we needed supervision or supervision needs to occur.
In regards to dispensing and filling?
Dispensing, yeah, we've never talked about dispensing without supervision, other than which we did not continue.
I mean, my comment would be the intention of the 340B program and the discounts is to offset the costs. And they're not appropriating those costs towards a pharmacist. That, you know, I don't know what they're using it, but that would be the reason why you would access 340B pricing to pay for these services, a pharmacist on site or whatever.
So, yeah, I think, I saw your testimony. I think I appreciate, you know, you did bring up all the board's concerns with the pilot project, and the value of a pharmacist.
So I guess,
So,
the big issue is if you guys want to oppose this, but I can continue to state the concerns. But if you guys just want to submit comments and concerns, are you guys just flat out opposing the bill?
I oppose the bill.
I don't like it as written.
And for the same reasons that you put in your testimony, there's a pharmacist on that, within within a mile, I think it's less than that, is what we established, that can give better care, in my opinion, or in our opinion, I guess, do you need a motion in our opinion that a person a live person is better than a remote and, filling, I think there had some dispensing errors that's concerning to the board. In the pilot project that they already demonstrated that there's some issues with errors. So as a board, we're here for safety and as I appreciate whatever this bill intends, but the safeguards aren't there.
The motion to oppose the bill?
I'm making a motion to oppose for those reasons. And Brandon
I second that.
is gonna second.
I was waiting.
Do
for
we have
Gary to-
consensus? Mark, do you agree?
Yes,
to
I agree.
oppose? Catalina?
I agree.
Agree. Okay.
He's still on the other side.
Okay, next, these are just a couple bills that we've just been tracking. SB 480, which was deferred, so don't worry about that one, but HB 712 relating to health. Prohibits drug manufacturers and wholesale distributors from restricting or denying access for pharmacies contracted with 340B covered entities to purchase 340B drugs at a discounted price under the federal 340B drug pricing program. Imposes civil penalties for those engaging in unfair or deceptive practices in the conduct of any trade or commerce. So this is just something I wanted to put on your guys' radar and then I'm tracking it. It doesn't directly change 461, so I try to stay out of it, and stay in my lane. So just a heads up on this one, unless the board really wants to comment on it. Okay, it's nothing from the crowd, it seems like, no hands raised. Okay, and then lastly, SB 956, which was deferred, so don't worry about that. But HB 951, which allows a patient seen in person by another healthcare provider in the same medical group as a prescribing physician to prescribe an opiate prescription for a 3-day supply or less via telehealth. Yeah, so this is another one that is rather vague. It's amending section 453 HRS. So as it doesn't touch 461, I stay out of it. There's no other comments, we can keep it going.
My comment was, how do we know? I don't think it says in here how long between the visits. And how is the pharmacist supposed to know that they actually had that visit?
Yeah, it still seems more like a rule for
Physicians.
the physicians. It
Yeah.
doesn't seem like something that they're expecting the pharmacy to police. Is like kind of like allowing them to do. I don't know, yeah.
Since we have a corresponding liability with controls, you know, I'm not sure what our place will be.
Yeah, I don't know.
We can comment as a pharmacist, do you like that? Or not?
Yeah. If you didn't provide testimony, you're just as an FYI.
Yeah,
But we can if you guys would like to. Yeah,
I mean, I think the only comment that we could make, Mark, is that, you know, the board is asking for clarification in terms of the responsibilities that this would put onto a pharmacist.
yeah, that's fair.
And just to voice that as a concern. And then hopefully in the bill, then they can clarify like, oh, this is not for you. Okay, thank you. You know, like.
so I can submit those comments the next time we see it. Let me just make sure, provide the most updated. Let's see where it's at. HB 9. Okay, so it will be crossing and it will go over to the Senate side. So I'll make sure we put these comments in the form of a testimony for the next round. Okay, moving on, I don't see anyone from NED. Or is there anybody who wanted to comment on that last bill? Nothing? No hands raised in here. Yeah, I don't see NED either. So number 8 is Hawaii Pharmacists Association.
Okay, I have some exciting announcements. I also have another bill. Do you want me to start with that since we're kind of already in legislative mode?
Yeah.
All you, whatever. you want to
Okay.
do.
We have a bill that we just kind of tapped into last week. So it's Senate Bill 1509. It was originally a pretty minimalist rebate bill. We were able to put in a couple provisions for PBM reform. So I don't know if the board normally does anything with pharmacy benefit managers or PBMs, but for awareness for anyone on the call as well, we added language that prohibits spread pricing. And we also put in a reimbursement rate floor. That's NADAC plus the Hawaii Medicaid dispensing fee. I know I'm getting really in the weeds, but what I ultimately want to say is if anyone on this call, especially our independent pharmacy owners, please reach out to me about this equation if it is going to negatively impact your fiscal balances. The equation that we chose is very consistent with national standards, but I know because of our remote location and some of the flexibility with federal contracts, we're a little different than many other states in the country. So this is an FYI. Senate Bill 1509 now has reimbursement floor language and spread pricing language. And then outside of that, we have our two events coming up. March 20, we're bringing back Advocacy Day at the Capitol. So we'll have students, practicing pharmacists. The State Association will coordinate speaking with legislators. And then attendees will be recognized on some of the chamber floor as well. So it's a really fun event. We timed it to match with crossover to keep momentum with some of our bills that are now being seen by the other chamber. But it's free to attend for both HPHA members and non-members. And information about that can be found on our website. And that's, again, March 20th, Advocacy Day at the Capitol. And then Saturday, April 12th is our annual meeting. It'll be held at the Oahu Country Club, 4 hours of live CE provided. Because of the momentum that we've got with PBM reform, and because I think our membership just wants to be more educated about PBMs in general, our speaker is going to be a national speaker that's going to be talking about PBM reform. And then there was a thought that if the Board of Pharmacy wants to present an update there about what you guys are doing for those that aren't able to attend the meetings, to maybe just have a little bit more cohesion with the profession, if anyone wants to give a brief update, we'd be happy to include that in our agenda too, no pressure. And then another exciting announcement, we got some grant funding that's gonna help us offset the attendance costs of Neighbor Island pharmacists. So we've been asking for that for a long time. So Neighbor Island pharmacists that maybe haven't been involved in the state association for a while, because it's pretty Oahu centric with a lot of our events, will be able to pay for $50 of a travel voucher to help with the cost of a flight to come over to Oahu for just a day. So those are my announcements, and I'm happy to take any questions.
Questions? I don't see anything.
Okay. Good, board's good? Okay. Oh, let's see. Can we,
Applications.
oh, so the rest of it's gonna be in about applications and adjudicatory matters, so these guys don't have to stick around. Next meeting, we decided, or we have on the agenda is like March 20th, at 9. In the normal room, first floor, we have quorum.
Yeah.
Yeah, I won't be there.
You won't be here, we'll check with Kent. So just so you guys know, the rest of it will be, we're doing applications and adjudicatory matters, so we're gonna go to.
I have one question.
Yeah.
Do you guys normally chime in on PBM reform? I haven't been in the state since a PBM bill's had a lot of momentum. Is that something I
PBM
should?
has not been talked about in the state for decades.
So should I be coordinating with James for that, or are you guys?
I think we need to
Okay.
keep it on the radar.
How's that?
I provided testimony as a private citizen, but the board probably you're neutral.
And I'll put it on the next agenda, just.
That's fine. I just wanted to make sure I'm
Let's
including. you.
track it and just make sure that, you know. We're gonna, normally the board always says it has to do with money. So that's not our thing.
Okay, cool. Thank you.
Yeah. That's okay, Stacy, you're good? Yeah, thank you.
Looking for exec session.
Oh, yeah. Can I get a motion to go into exec session?
I move to go into exec session to review personal information and
Okay.
consult with their attorney.
I'll do a second. Yeah, okay. All in favor? Aye.
Okay, so Catalina and Mark, just staying here. We're gonna pull you into another room, Zoom wise, so you don't have to go to Teams.
Okay.
And those attending the meeting in regards to applications, just hang out and we will call you if needed.
That's when we, the people. Come back.
Thanks, James.
Yeah.
Yeah,
thank
you guys
for
good?
coming.
Yeah, thanks for coming. Nice to see you guys.
Yeah.
Even getting it. Forum.
So next meeting, at least it's in person, it'll be before the whole like,
You're right.
this stuff, right? Good. All right. For section 9 applications, can I get a motion regarding the ratification list that's attached to agenda, minus some of the typographical errors?
So hold on for just a bit.
Okay. My note was bad.
Parking lot.
Taking notes.
Okay.
You guys
Hey,
just.
Mark's back.
Hey, Mark, glad to have you back. You can just turn on your
Yeah,
Camera back on. Where's Mark?
right there.
Mark, your screen's black. You got
well, not sure what happened there.
Audio is enough.
audio is
Okay.
enough? Okay. Okay, so regarding applications, ratification lists, I move that we approve the ratification list minus typographical errors and duplications on the ratification list. Can I get a second?
A second.
All in favor? Aye.
Aye.
Okay. So ratification list is approved. Regarding applications, miscellaneous permit for Taylor's Pharmacy LLC. Can I get a motion to
Approve. I move to approve.
motion to approve?
Sherry, I second.
Second, all in favor? Aye.
Aye.
Aye, okay, okay, unanimous. Next one is buy rights, drugs. This is Alana. I make a motion to deny his application, based on 461.21 A5, and 436 B 19.13, discipline in another state, revocation and discipline and disciplinary action in another state. Can I get a second?
I second. It's Mark.
Okay. All in favor? Aye.
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 I,
Unanimous?
Yep.
Next one, PRXP of California LLC. Can I make I'll make a motion. Can we, just defer? Okay. Okay, and the next one is Link Pharmacy Corp. Okay, right.
Yeah.
I'll make a motion to approve Link Pharmacy Corp. Miscellaneous permit application. Can I get a second?
Kelly, I'll second.
Okay, Sherry. All in favor, aye. Aye.
Aye.
Aye.
Aye, okay, unanimous. Chapter 91, HRS adjudicatory matters.
I've done one motion if you want.
Oh, okay, I move that we approve, Express Scripts and Long's Drugs, settlement agreements. Can I get a second?
Mark, I second.
All in favor, aye?
Aye.
Aye, and Catalina.
Aye.
Okay, so next meeting, we said was already Thursday, March 20th. Brandon won't be there. Everybody else said that they can get, we'll check with Ken, right? Anything else? Sherry, you're gonna make March 20th is okay for you? Yeah. No, Sherry, you should. Good? Okay, all right.
The third, right? The
Yep.
third week.
Yeah, the right one. Okay, meeting adjourned.
Bye.
Bye, thank you, guys.
Bye-bye.
do you want us to keep any of these?
Are you gonna remember to?
No, I won't.
for-
No, I won't.